Thank you very much, Star. And of course, we are continuing our Back to School series. We're very pleased having us joining us once again on Bahamas at Sunrise. Here we go. Here's that word. Endocrinologist and obesity specialist, Dr. Christine Parker-Curling. Welcome back to Bahamas at Sunrise.
Thank you very much.
We've talked about diabetes before, but usually when people talk about diabetes, we think it's associated primarily with adults, but of course, children are also affected by diabetes.
Yes, they
what's
are.
the difference between juvenile diabetes and type 2 diabetes?
Okay, typically when we think of diabetes in children, people think of juvenile diabetes, which generally refers to a condition where the body ceases to produce insulin. So somebody who has juvenile diabetes really is dependent on insulin for management of their blood sugars. Type 2 diabetes is the type of diabetes we typically think about occurring in adults.
Right.
But with the change in the population, the change in dietary habits, the change in body habitus, we're starting to see a lot of type 2 or adult type diabetes in younger children.
How do you diagnose diabetes in children?
The diagnosis of diabetes in children is pretty similar, the same as diabetes diagnosis in adults, based on an elevated blood sugar above 200, based on hemoglobin A1C, or also based on a fasting blood sugar. So if you think that your child may have diabetes, you should take them to the doctor. The diagnosis is pretty straightforward.
What would be some of the indicators of that? I mean, you say take them to the doctor. How would you even know?
Okay, so some of the things to look for. How do you have the suspicion, or what should raise your suspicion that the child could be diabetic? Most of the symptoms of diabetes have to do with elevated blood sugars. So if a child is thirsty all the time, child is drinking a lot of water, waking up to pass urine in the night, for the teacher, a child that's taking frequent bathroom breaks, maybe a child is losing weight, is listless, has less energy, is not concentrating, has blurred vision. These are the types of things that would probably prompt you to take the child to the doctor anyway. But they could be very consistent with diabetes, and it's typically the story that the parents would tell me.
So right away, if a teacher in the class or even at home and you suspect these types of things, you just take them straight to a doctor.
Yeah. And if you're really concerned, you could take the child to the nurse, send the child to the school nurse, and even that facility might be able to check a blood sugar and raise the alarm for the parents.
What are some of the risk factors if, these indicators are not caught in time?
Okay, so for the juvenile type diabetes or type 1 diabetes, which is the insulin dependent diabetes, actually for both of them, a strong family history. So if, mother, grandmother, aunt, cousins, sisters, brothers, or lots of people in the family have the condition, I would say have a very low threshold for taking the child in to be evaluated.
Okay. And in terms of complications from diabetes?
The complications from diabetes, like we had discussed on a previous show, are similar actually for children than adults. Same for the children and the adults. The concerning part is, or the way I tend to counsel patients is, when we typically think of diabetes occurring in an adult who's 60 years old when they're diagnosed, then you have 10 years of uncontrolled diabetes if you're unable to get a grip on it. And you don't see these types of complications like, difficulty with vision, losing your kidney function until you're 70. And not that that is not tragic, but if you're starting with uncontrolled diabetes from the age of 10, and you're seeing complications at age 20, then you could see the quality of life changes are significant.
Wow. Significant. How do we prevent this, especially in children?
The prevention of diabetes in children is possible. The type 1 diabetes or the juvenile diabetes is more of a genetic disorder, an autoimmune disorder that you really don't have control over except to look out for the signs, diagnose early, treat, and prevent the complications. The type 2 diabetes and the rise and increase nationally and internationally is really correlated with the excess body weight that we're tending to accumulate. So if we can get our children active, if we can encourage outside playtime during school hours, we can promote running around on the playgrounds, joining physical activity related extracurricular activities, and also avoiding sugary beverages, sugary snacks, preserved foods. These are the things that increase the risk of increase body weight and therefore directly increase the rate of obesity and diabetes.
Dr. Park, I've got a million more questions for the
I
course
know.
as things go in Bahamas at Sunrise. But for those persons that want to contact you, how can we do so?
Okay, I practice at the Family Medicine Center. The telephone number is 702-9310
Right.
or Oncology Consultants Limited, 322-5845. Those are the numbers.
All right, she reeled them off fast this time for us at Bahamas at Sunrise. Thank you once again for joining us.
Thank you. You're welcome.
All right, you're watching Bahamas at Sunrise. We'll be right back.